Hey guys, I'm Dr. Josh Jagoda, and today I want to discuss with you shoulder pain and one simple mobility drill that you can do. This is a really common problem. You know, a lot of people have shoulder pain, a lot of people have shoulder dysfunction, and in order for you to actually properly treat the shoulder, you're going to have to treat the deltoid muscle. And that is like this flap of muscle that kind of attaches up here, kind of comes broad, and then it kind of comes down in this tear shape, dropping right up into here. And you know, in order for you to really get down to other muscles, it's really good to work this one first. And you know, it's not always perfect, and you may have to kind of wiggle back and forth and try different angles in order to really find that release. But if you follow this little method, this can really help you. And there's 3 different fibers that we're going to be worrying about. So if we kind of go like this, we're going to have an anterior fiber, middle fibers, and posterior delts, right? So we have an anterior, middle, and posterior delt. Front, middle, back. And so today we're going to show you how to mobilize all 3 of them. Really, really simple. So the first thing I'm going to do is I'm going to place this ball right up against the wall. And I can be really simple and easy and just do this, like, you know, mash up and down. And all I'm really doing is taking the ball and rubbing it up and down, going back and forth, back and forth. And then, you know, and you can move your arm backwards just like this and keep the ball in place and move your arm. Or you could keep your arm to your side and rub up and down and get the ball going this way. You could do the same thing with the middle, and the posterior you can do a little bit of that as well. So I'm going to just show you how to go up and down easily. So you're going to kind of just bend your knees going up and down, and then I can switch to the side going up and down like this, and then I can come back going up and down, back and forth, side to side, whatever you want to do. So now that is where the ball stays still, but you are moving up and down. And now what we're going to do is keep the ball staying still, but you're going to be moving through some shoulder dynamic movements. So first things first, you're going to start here, and then you're going to reach back. Come back and reach back. Leaning in, changing the angle if you need to. So that's for the anterior. For the middle, it's a little bit different. We're going to mash right in. We're going to take your hand, and I'm just going to roll forward a little bit, and we're going to reach back. Good. Come back just to your arm like where it's here, and then I'm going to reach backwards behind, like as if I'm reaching for my wallet. And then I take my other hand and I stretch it out. And that's how to get the middle fibers. And then the posterior, you're going to have to change the angles quite a bit differently on the posterior one. And what you'll do here is you'll find that, and then you're going to bring it across and down. And across and down. And so the interesting thing about working the deltoid for shoulder pain is that you may actually not even feel any tenderness or discomfort when doing it. It actually might just feel good the whole time. And a lot of people will be like, well, I'm not pushing hard enough, or I'm not on the right muscle. You may be on the right muscle. The reason the deltoid, like I said, is so important is because it's a flap of muscle that covers up some of the muscles within the rotator cuff that are really, really important to get to. But if you want to be more effective in getting to those muscles, you have to go through the first layer, to start, right? You have to go through the first layer first, right? You can't go to the second layer first. You have to go to the first layer. So once that arm and shoulder is loosened up, then you can go down and a little deeper, try for those tender points, try to move your arm and shoulder around, because really, it's really about being effective, not necessarily pushing harder, right? So that's what people have to realize when you're having shoulder pain. It's about being effective and doing the job that you need to do. And in order for you to actually treat the shoulder or self-treat the shoulder a little bit more efficiently, you have to work some of the deltoid muscles. All right, guys, so whether it's a front shoulder pain, middle, or even back of the shoulder, either way that you have this situation or these mobilization techniques will have you covered. So give this a try, guys. I'm Dr. Josh Jagoda. Thanks for stopping by. Don't forget to subscribe to our channel. We'll see you guys for the next episode. Bye.